repeat any of my past previous talk if there is a demand for it. But I don't want to have recorded because I want them to come. So my previous talk, if people request for it, they can request, and if there are enough requests, I will repeat that because a lot of people say my diabetes one was good. They wish their friends or relatives were here. Fair enough, I understand that, and I'm willing to repeat it. And for that, the report, I don't think I want it. I want it recorded, but don't publish it.
Okay.
So you did the diabetes talk?
Yeah, I did the diabetes. Explain why it kills you, why it's so bad, and what to do with it.
Okay.
So this one is on gastroenterological disorders, which is the stomach. Again, stomach disorders are very common. A lot of people have issues with the stomach, and so that's what I'm going to talk about today.
And so, based on this technology that can heal things that you...
The medical science is a lot is medical science,
Right.
because most people don't know about it. Most people don't know the latest in medical science.
Yes.
I have the background. I used to be a researcher.
Okay.
I've done research. I know what research is, how strong the evidence is. You know. So it's on that basis that I give this talk. Okay. So you know that heat and cold have been used in therapy, and physiotherapists use them. Hot compressors, cold compressors make use of heat, and heat can affect the way our body function. So Hippocrates was right. You know, he has the wisdom to see that this is an important concept. And of course, Einstein said that its frequencies. If you remember his famous equation, energy is mc squared, basically say that mass and energy is equivalent, right? So ultimately, energy we're talking about is either photons, particular, or wave-like. No? Either way, it's frequencies. So it makes sense to look at it this way. And recently there's a lot of interest in terahertz, and I will explain what terahertz waves are. But this is the latest in understanding science, because it's in health, which is where I'm in. It's in science itself. We are researching what the possibilities with terahertz wave. It's military using it for security reasons. Agriculture is being used. Communications. Any of you have a 5G phone? You don't have. Well, 6G is being studied, and 6G is terahertz waves. Okay? So this is very advanced science. A lot of people, a lot of universities in the world are doing it, including local NUS engineering department have studied it. And a lot of terahertz research comes from all over, from Russia, from China, Israel, USA, Europe, all over the world. It's a growing science. If you search for articles on that, mostly you will find scientific articles which you will not understand. The engineering ones I don't understand. The medical world I could understand about 50-70% of it. So this is where we are. So terahertz wave is in the electromagnetic frequency, from very long radio waves to very short X-rays and gamma rays. Visible light is here, a very short bit of the electromagnetic spectrum. Terahertz wave is between infrared and microwaves. You all have used microwave. It can penetrate whatever food you put inside. So terahertz share the same property. It can penetrate your skin and reach the cells underneath your skin, reach even your bones even. It share the same properties with infrared, and if you're aware, there are a lot of infrared health devices. During COVID, for instance, in USA, it was discovered that infrared devices can actually heal people from their COVID symptoms.
Right.
And they were very excited about it. They trained technicians to administer this to the patients so that they recover from COVID. And so terahertz share this property. So we are talking about the medical aspects of terahertz wave. It can be used for diagnosis. For diagnosis, you can actually see several layers. For example, radiologists who describe terahertz waves looking at the bones could distinguish 3 different layers in the bone. I didn't know the bone has 3 different layers, but that's what they say. This one could differentiate. And then of course, for therapy, we have the devices here and a lot of other devices that they are now trying to sell, which is a good thing. Now, why terahertz waves are so important for therapeutic purposes? For this one reason and one reason only. Terahertz resonate the same frequency. You all know that everything has a resonance frequency, right? Soldiers crossing a bridge, if they don't break up their step, the same frequency, if it resonates with the bridge will collapse. There are accounts of this happening. And you know the singer, especially sopranos, can sing at such a high pitch and at such a volume that it can crack the glass. So everything has a resonance frequency, including our cells. And our cell resonate at a frequency that is in the terahertz range. So our terahertz waves produce, the waves that our devices produce is at a frequency that can resonate at the same frequency as those of the human cell. So for these devices, it's a combination of Chinese and Western technology. Now, these are the properties that are of interest to us. Firstly, terahertz wave is low energy. It's not like X-rays. It won't destroy, it won't damage our tissue. It penetrates through materials. So if you shine it from here, you stand behind the door, it will still reach you. So it can go through all this. These are materials with dielectric property. That means they are non-conducting. Okay? So anything that won't conduct electricity, it can penetrate. But anything that conducts electricity, including water, it will be absorbed. Now this is an important, property that enable us to able to see them. And because different biological systems, even the skin, for example, there are many layers, different concentration of water, so they are absorbed differently by terahertz waves. And that's how you can see the different layers, you see. And so it's just like shining a torch in a dark room. Or if any of you have used infrared camera, you understand. So infrared, even though there's no light, you can see. You can't see the infrared rays, but when captured on the camera, you can see because of the infrared rays. So terahertz waves is like that. This is called Rayleigh scattering. It's like shining a torchlight inside your body. You can see the different things. So these are all used for diagnostic purposes. But for therapeutic purposes, we use this thing that it does not damage biological tissues and it can affect biological tissues, particularly hydrogen bonds and van der Waals forces. Van der Waals forces are very important because they cause water to have this viscosity. You know the water is viscous. You pour the water out of a glass, and then you put it upright again. You see that some water is sticking. You can let it collect, and you can pour out some more water. That's because of the viscosity of the water. In water that are radiated by terahertz waves and in the alkali water, the van der Waals forces that hold water molecules together are broken. So when that happens, the water is more separated, more able to penetrate. And so that's why alkaline water is effective. In spite of what physicians may say, oh, but the stomach is acidic, it's not like that. Once the forces are broken, it's easily absorbed. Once it gets absorbed, the broken up water molecules can penetrate much better. Doesn't matter whether the stomach is acidic or not. It's the physical property of the water that matters. So how does terahertz waves affect your tissue in your body? a lot because it provides energy, it increases activity. Because apoptosis means the cell die. The apoptosis is a term for the phenomena where a cell literally commits suicide. It just fall on itself and die. So this is how the body deals with abnormal cells. So even if they are foreign cells like bacteria or COVID virus, the body has cells, mast cells, and certain white blood cells will engulf the bacteria, and after they engulf the bacteria or the virus, it dies. You see, and that's how we get rid of all these substances. In cancer cells, it disrupts the DNA of cancer cells. I will talk about it later on. It decreases inflammatory proteins. Now, a lot of diseases have to do with inflammation. And certainly, if you look at YouTube, there are a lot of people who have inflammatory conditions where they use these terahertz waves to kind of blow over the affected part, and the inflammation dies down. It becomes normal color again. It's amazing what it can do, and this is the effect. And if you are like me, have used this after some time, you notice that certain functions come back. This is an anti-aging property. So, theoretically, you find that because of my age, certain cells don't produce the usual thing they used to produce. When I use this, it comes back. Quite amazing, like getting younger.
Yeah.
That's why I call it anti-aging. And it increases cellular division for repair, for whatever, to overcome whatever shortcomings there are in your biological systems. So, just a reminder, because it's the same frequency, you will eliminate abnormal cells. Okay? Activate inner cells. Normal cells will absorb the terahertz waves, and then if they're not functioning, as I say, like a lot of glands, as you grow older, stop functioning, it kind of activates it again. And this is important because, let's say any secretion, your thyroid hormone, for instance, will have a range from the lowest to the highest, which is the doctor considered normal. But when you are young, you're probably at the 70 percentile level, right? As you get older, it go down to 50, and go down to 30, 40. The doctor says, oh, it's still normal. But when you're young, you have 50 percentile, and now as you get older, it now dropped to 30 percentile. Of course, you've got less energy, isn't it? So, terahertz waves is able to get it back to normal. And this aspect of terahertz function is terribly important for you to feel alive again. So, that's how you see a lot of diabetic and stroke patients recover from their symptoms. So, because it resonates at the same frequency as normal cell, it allows DNA molecules to be activated. To make it simple and yet a bit technical, the DNA is in two strands, right? When they're in two strands inside the cell nucleus, it cannot produce whatever it's supposed to produce. Terahertz waves is able to unzip and cause the production of the chemicals that the DNA is supposed to produce. And that's how we get this effect. So in unblocked meridians, meridians are for the return of fluid back into the heart, so that unwanted substances can be detoxed and the fluid can be drained and function can be normal. So this is an important function of the meridian, and the terahertz waves has a huge benefit, and it's very useful in heart and kidney conditions where there's a lot of water retention. And it's always get the kidney and the heart to function properly, so it will get you back to normal. And those amazing testimony you see in YouTube are because of this function. You see? improve the microcirculation. So besides the meridian, also the blood also carried back, especially the waste products. So the microcirculation are the tiny capillaries all over your body. Okay, when they open up, they drain that part of the body. So this complements the effect on the meridian. So it will, once the circulation is open, the capillaries are open up, blood can flow through and all the things can flow back, water retention is reduced, all the toxic substances are also removed. So the end result is water retention is relieved, right? And that's how we can balance out our body again to be normal. So I will talk about gastric stomach ulcers. There are two types of stomach ulcers, gastric and duodenal. I will show you the picture to help you to understand where they are. Gastric ulcer usually between the antrum of the acid secretory mucosa. I will show you what the antrum is. The stomach is very huge. It can happen anywhere, but there's a certain part where it occurs. It's the same with duodenal ulcer. Duodenum is the initial part of your intestines, your small intestines. I want you to note this. H. pylori infection is very common in ulcers. H. pylori is Helicobacter pylori. Okay? This is shallow or deep ulcers. These are usually small. You see a lot of inflammatory cells. You can end up with hematemesis, means vomiting blood. People vomiting blood is due to ulcers. Or melena. Melena means, to be very crude, you shit blood. You pass blood. Not as frank blood, but digested blood, because it's from the stomach or from the duodenum. As it passes through the intestines, it gets digested. So you get digested blood. If you get frank blood, it's from your colon. Digested blood is from the stomach. That's how you can tell. And there's always pain. That's how people know. And the important distinction between the two is that this one, gastric ulcers, can give rise to malignancy. In other words, gastric ulcers can become cancerous. That's why it's important to deal with it. Causes of stomach ulcers, I say the most important cause is infection. Then the use of painkillers. A lot of people with arthritis particularly use painkillers, and they use powerful painkillers. And these painkillers can destroy the stomach mucosa, the stomach cells which protect your stomach from the acid that is being produced by the stomach. Okay? So that's why nowadays anybody who take this kind of chemicals are told that they must take antacids together with it, so that it won't destroy the stomach cells. Smoking and alcohol contribute to gastric and duodenal ulcer. It's very important. Smoking, there is no reason why you should smoke. There is no benefit at all except to make you feel high. Stress. I used to work in a surgical department, and I can tell you, in those days, complications of ulcer are always coming, and they always happen for Chinese before Chinese New Year, and if they are Christian, they celebrate before Christmas. For Muslims, the gastric ulcer problem usually comes before Hari Raya and those kind of things. So it's well known among surgeons. So the understanding is stress caused this kind of thing. Stress did not directly cause the cancer, cause the ulcer, but stress caused the acid production. A lot of acid produced, and because a lot of acid produced, your risk is higher. See? So that's why the surgical boys always notice that before an important event, a festival or whatever, or before a very stressful event, before getting married and all this kind of thing, you get all this kind of nonsense. You see? So Now, these are the type of ulcers. This is the first part of the small intestine, the duodenum. Okay, this is the antrum. This part is called the antrum. And this is a lesser curvature. So ulcers along here, or even along this, can easily turn cancerous. This is a gastric ulcer. Then there's another ulcers that's very important. Is the esophageal ulcers. I will explain why esophageal ulcers are important nowadays. It's getting increasingly common. So complications. What are the complications? Bleeding. So you have loss of blood, anemia. When the bleeding is severe, it's vomited out. And if you have seen this, it's horrific. Because when a person vomits, what it means is very severe. So the first thing you do is quickly get him down, insert a drip, establish that line, and once you get the blood cross-match, you quickly order the blood and infuse, and you can save the person's life. The other thing is, the ulcer can eat through the stomach wall. It eats through the stomach wall completely until there's a hole in the stomach wall. When that happens, what's the result? Acid leak out of the stomach into your abdomen. And it causes a very severe inflammation. You are in terrible pain. You can't move because it's so painful. That's called peritonitis. It's a surgical emergency. You rush a person into the theater, open up the abdomen, and you close the hole and clean up the abdomen. You flush saline in and wash out all the acid in the peritoneum. It's a very messy operation. I've seen it being done. You've got to flush it through several times, not once, several times. Remove all the acid. And then the patient then slowly recovers. It takes days to recover because the acid causes a response in your abdomen. It is terrible. And yet a lot of people who have ulcers because of stress or whatever reason, ignore it, They didn't realize it until they're in hospital, you see. So I suppose when you have to make that few dollars more, is so important that you make the few dollars more, that people neglect their health, even during these days. So this is an important complication. You can die from it. And if you have repeated bleeding and healing and all that, you have a scarred stomach, it can cause obstruction. In other words, because it's scarred, the muscles don't operate anymore. The muscles are dead, replaced by fibrous tissues, and so food cannot go through, and there's obstruction. And of course, with gastric ulcer, there is up to a 1/4 chance that you can get the cancer. And that's serious. Prevention. We discovered Helicobacter about in the 80s, thereabouts, and once it was discovered, treated with antibiotics. I've gone through 2 courses of antibiotic treatment for gastric ulcers, and my last gastroscopy, no more infection. So that one is clear. Limit use of painkillers, including aspirin. And for ulcers, this is a standard treatment now, proton pump inhibitor. Or you probably know it as omeprazole. Proton pump inhibitor has this effect. It blocks your stomach from producing acid. Acid is a hydrogen atom, right? So the hydrogen atom is a proton. So the stomach has a pump, a chemical pump, that push out the hydrogen into the stomach cavity, and so it becomes the acidic component of the gastric secretion. So it's called a proton pump because the pump that push out the proton, the hydrogen ion, is blocked, is inhibited, and that's how the acid is reduced. Older medication like antacids, preventing, stop by blocking the effect on the stomach cell to produce. But this is the most powerful. And if you use alcohol, don't take too much. Take as little as you can. Stop smoking. Oh, any food that is processed, pickled, smoked, and salted, avoid.
Everything already.
Huh?
Almost everything cannot eat.
Yeah. So diet, high fiber diet protects you from against a lot of things. Avoid caffeine, cocoa, and alcohol. Caffeine and alcohol are very powerful stimulants of acid production. And of course, if you eat raw food, there is a chance of infection. We've seen a few. People like sashimi and sushi, so we see them. And at one time, the Chinese also eat yu shang, which is raw fish. So they add on to the risk. So this is how stomach cancer looks like. There's an ulcer here, and then it becomes thickened, right? When it's thickened, it's like that. And if you look through a gastroscope, the appearance like this. This is a cancer. Stretch. Thankfully, we now have the gastroscope now. And if you want to protect yourself from cancer, once you pass 45 at least, I think you should have a gastroscope every 5 years. My father died of stomach cancer, and in those days people don't know. In those days they don't have a gastroscope. The first gastroscope came around 1975 or 76. I was a house officer at Toa Payoh Hospital, and Champion, the gastroenterologist, was showing off his gastroscope. At that time, the gastroscope is not like the fiber optic gastroscope that we had. It's a metallic gastroscope. So when you want to put in the stomach, the person have to put his neck back, so that from your mouth to the stomach must be a straight line. Otherwise, the metal gastroscope cannot go in. Now fiber optic is so easy. So that's what stomach cancer looks like. It's quite horrible. My father, when he realized that he has a lump in the stomach, and he asked me, "You have a lump in the stomach? Quickly call my colleague, get him a burial meal, demonstrate the cancer was there, and send him to a surgeon straight away." Because his stomach was completely removed. He lived the next 5 years without a stomach. So he has what is known as a dumping syndrome, where food get rushed through his intestine. So we eat in small amounts. So nowadays we see less of that, but some people still come with this, and if the spread is too much, we only cut out a section of the stomach. Different kind of operation you don't need to know, you know. So stomach cancer symptoms, most of the time we don't know. That's why I say every 5 years, if you are past 45, you should go for a scope. If there are symptoms, loss of appetite, loss of weight, you have difficulty swallowing, you feel a fullness because of the lump there, heartburn, indigestion and nausea. And if you do a blood test, you find you have not enough blood, anemia, you may find blood in the stool, and the only way to confirm it, unless it gets so big that you can feel it, it's too late already, is to do a gastroscope. So that is how we know you have cancer of the stomach. And with increasing age, this becomes more common. So cancer of the stomach, elderly, the older you are, the more likely you're having it. 60 years, male have a higher chance, more than 60 years, and you're male. If you're female, you have a lesser chance, but you still get it. There's no exemption as far as sex is concerned. Smoking and alcohol make it worse.
One male get more than woman in terms of statistics.
We don't know. It's probably in a genetic background. Infection with Helicobacter, smoke, processed food, overweight and obesity. Blood group A has a higher percentage of stomach cancers. Your blood group A, just go and check out, come here. So, a B12 deficiency. B12 deficiency occur in vegetarians if you didn't take vitamin B12. So while it is healthy, if you don't supplement with B12, especially as far as your stomach is concerned, you get a higher risk of stomach cancer. So there are a lot of risk factors, and you got to assess it yourself and decide how much at risk you are. And if you're at risk, even if you're not at risk, go for every 5 years gastro. That's what everybody do now, you know. And colon cancer is the other one. So I've gone for my colon and gastric cancer, but I'm on follow-up. I do my gastroscope more often because I have a ulcer problem. I have an esophagus problem as well. I'll explain to you when we come to it. Okay, but my colon is quite okay. I went for 3 scopes so far. I will be having colonoscopy in 1 or 2 years' time. You see, so this is how you protect yourself. So yeah, we've gone through this already. Basically, diet, limit processed food, stop smoking, lose weight, and so forth. Okay, this is gastroscopy. Now, because of the fiber optic gastroscope, the fiber optic scope can bend, and so you can go through the mouth, and there's a light at the end to let the doctor see where he is. So this is how it looks like. We just push this in and it will go down there. Fiber optic scopes are terribly important nowadays. With this, I have a ultrasound using this of the heart. So it goes in through my veins and go all the way back to the heart, and you can actually see the inside of the heart. Amazing. Medical technology advances to a great degree, and you can visualize a lot of things nowadays. Now it's even more advanced. When I attend a recent conference, mind-boggling what we can do. GERD, gastroesophageal reflux disease. So we got rid of a lot of gastric ulcers by treating the infection, right? Helicobacter pylori. Well and good. So we get less gastric infection. We get less gastric cancer as well. But there is a bad side to it. As gastric cancer reduce, as gastric ulcer reduce, esophageal ulcers start to appear. Why? Because you have dealt with the thing, so your stomach's normal function should produce acid. The acid will go somewhere, and you live longer, your muscles get looser, it can go up, and you go up to the esophagus. So flow back as far as the mouth, and one result is bad breath. So if you have persistent bad breath, take a look. It may be due to this. It's certainly true. Sore throat, hoarseness of voice. These are kind of non-specific symptoms, but there's an indication that you are having a reflux disease. And if you sleep and suddenly you have like food coming out through your mouth or acid coming through your mouth, that is reflux. It happens usually during sleep. So watch out if you sleep have this problem, you have a reflux disease, you must get it treated, because the bad news is 17% of GERD associated with cancer. Bad news. So this is healthy. You have a sphincter here, muscular sphincter is normally closed, so your acid flow back. In GRD, the sphincter is open. As you get older, you get all kinds of problems. Or your sphincter, your urine, for example, you may have difficulty. You may either leak urine or you can't pass urine or whatever, you know. So stomach, this thing becomes loose and the acid goes up. And sleep, when you lie down, it will go all the way to your mouth. And then, as we say, this acid reflux not only causes irritation, esophagitis, it can cause cancer to develop. That's why it's bad. You see? And the more we can control the gastric ulcers, the more this thing appears. So this is important now. In my medical school days, we never heard about this kind of things. So esophageal cancer, the most important thing is you can't swallow. And weight loss, you know, and so forth. And because the esophagus is behind your heart and behind your lungs, you get chest pain, you got pressure, you got burning. So, this esophageal cancer, this is how you look like when they do a scope, okay? So nowadays, a lot of us, including myself, the stomach is normal, because we're quite well treated, but this becomes an issue. So my last gastroscope, there's a lot of erosion here. There's a lot of tissue damage. So got to eliminate that. Make sure the posture of my sleep don't allow for reflux by elevating the head. And we are concerned about the cancer. Treatment of cancers. Well, in this location, if it's early, we want to remove it totally. Followed by either one or the other, depending on where you are. If it's beyond surgery and radiation or chemo may not help, we need supportive therapy to nurse the patient through until they go away. Now, this thing helps a lot. One of the amazing discovery in the last 5 years or so is a THz wave. As you heard earlier, THz waves have an action on the DNA. Now, cancer cells' DNA have what is known as a methyl group attached. Okay? So THz wave can actually demethylate. Amazing. It detaches the methyl group and the cancer cell is ineffective. Amazing. And it's discovered by quite a few places. Of course, your cancer must be earlier. Too late, can't help. And besides this advance, there's another advance. Recently, just occurred a few years, reported in the internet and in medical journals. They found a way to treat cancer cells without you having side effects. Amazing. How? Your immune cells. They discovered that sometimes immune cells are suppressed by the cancer cells. And they found a way to activate these immune cells. So actually it's immunotherapy using the immune cells in your own body. Activate it and kill the cancer cells. I believe THz waves have this effect as well, but no one has provided evidence yet because of all the effects I showed you. You know, so it stands to reason that THz wave can have the same effect, activate the immune system, and actually attack the cancer cell. But this can only happen if it's early. If the cancer is too widespread, very difficult. You see, it's just like surgery and everything don't quite help. But immunotherapy, if it affects the immune system, it will help because immune cells go all over your body and it can remove them. So what's a 5-year survival rate? In stomach cancer, if they are local, that means just there, it hasn't spread. The survival is 70, that means you have a 70% chance to be alive 5 years after. Esophageal cells cancer is worse. If it's localized spread, only 46%. You have a 46% chance of surviving. My dad was very fortunate. Stomach cancer patient, even though a big lump, which means that it probably spread further, he was able to survive 4.5 years thereabouts, which is quite good. If it spread to the region, it means surrounding tissues and so forth, 32% for stomach cancer, 26% for esophageal cancer. If it spread to very distant parts of your body, very poor. Only 6% survive stomach cancer and 5% survive esophageal cancer. So very poor survival rates in the cancer strain. So practically very little chance of you surviving. So in all my talks here, I have always emphasized about behavioral modification of your lifestyle. Diet is terribly important, and the kind of food, less fried food and less processed food. Fried food give you chemicals that are toxic to your body. A sedentary lifestyle is harmful. We are meant to be active. When you're active, you retain your muscles. Otherwise, you lose your muscles. Your muscles is the basis for allowing you to be mobile and to be active. And then don't forget to measure certain things, your blood pressure, your cholesterol, and depending on what you have, so your hormone level, your blood sugar level, your prostate antigen level, your liver function level, depending on where your weakness is, you did need to monitor that. Then there are preventive strategies. If you are being treated by a specialist, take the required treatment and supplement with supplements, health products, aids, things like THz Blower, anti-aging techniques, stem cell nutrition, which I also promote, as well as THz device. So all in all, by living a regulated lifestyle, you can put more years in your life, add more years, live longer, and more life in your years. Don't spend long life, but inside the ICU on a respirator. That's not the life you want. And that's how we ought to live. Okay? So an ounce of prevention is worth a pound of cure. That's certainly true. And that is my message. So finally, iTeraCare is suitable for inflammation, we say earlier on, all kinds of aches and pains, all kinds of blockages, and the skin. On the skin, it has a very good effect, and this is what it can be used for. Not recommended for pregnancy, acute diseases. Acute diseases should be treated urgently, hospital, nothing except that. I know because I've attended acute cases. Chronic cases don't come to hospital in the middle of the night. So one night I got a lady admitted, and then the admitting doctor said it was Parkinson. How long the Parkinson? 3 years. But 3 years you don't come in the middle of the night lah. So I keep asking repeatedly. Finally said, I have chest pain. I can't take it. Oh, okay, chest pain. Yeah, that's why she's there in the middle of the night, isn't it? Quickly do a ECG, and what we discovered was a massive heart attack. We tried everything, set her on drip. Unfortunately, she died 2 hours later. And the case remained in my mind as a strong reminder. Always find out why a person take a course of action. She didn't come to the hospital because she has Parkinson's for 3 years. Come on, it's 3 years already. Not urgent. there's something that push her to go to hospital in the middle of the night. And meeting doctor miss it. I cannot miss it. If I miss it, I'll be given a earful. So asked repeatedly, asked finally, she said chest pain. Lucky she said that. And lucky we discovered a heart attack, otherwise post-mortem discovered it. It's very shameful. That we cannot pick it up. So acute diseases, get to hospital. Congenital conditions we can't. Objects implant we can't. Open wound and fractures not recommended. So thank you. That's the end of my lecture. I want you to see some things. This is a scan, a bioresonance scan that can tell you what is wrong with your body. There are many scans available. I have this as well. So it will scan your body from your head to toe. It can even scan your chromosomes, tell you which chromosome is abnormal. So special rate we can charge you. I have certain courses and coaching programs that are available, and they are from $25 onwards. Some of them are available on Udemy. I have my books there for sale. If you're interested in my books, it's on stress and mindfulness. And if you're interested in my books, I have quite a few books on which are e-books, which are downloadable. Okay, so that's what you can get from me. And this is my contact. And if you would like a resonance scan, this is the phone number to contact, and we can get it done for you. So now I'm willing to answer any question. Any question you have, I will answer.